Imagine this, a rash shows up on your chest, it spreads to your arms and then your face. You panic, but by the time you get to the doctor, it's gone. The dermatologist kind of shrugs. It's hard to say. There's no testing or diagnosis, just a vague cream to try next time it comes. And sometimes that rash is a warning sign of something serious. It could be the early sign of Lyme disease or even an allergic reaction that can get worse the next time. Hi, I'm Dr. Karthik Odeyapan, and I help patients with hard to diagnose medical conditions. Rashes are one of the few things in medicine that we can see with our eyes. We don't need a fancy MRI or a biopsy if we act fast. The key here is to preserve the visual evidence. In this video, I'll show you 4 tools to track your rash like an expert so that your doctor has the best chance of figuring it out. Stick around to the end and we'll also talk about warning signs that would mean you should not wait until your appointment and get help sooner. Let's start with the most obvious tool that most people actually skip. It's photos. You'd be surprised at the amount of patients that I see in clinic that tell me something like, I had this crazy rash last week, and they're not able to show me a single photo. And it's a bit awkward because I'm not sure how to help them at that point. So definitely take photos. I've also seen patients that show me photos, but their photos are confusing or too dark. So here are some pro tips to get good photos to preserve that evidence of that rash. First, make sure that you're in a well-lit area, like near a window, or all of the lighting is on in the room that you're in, so that there isn't any shadow that's cast on your rash. The second tip is consider having someone else take your photos for you. You know, it might be easy to take your own photos if it's a rash on your forearm or your leg or your foot, but if it's somewhere like on your sides or back, really think about having someone else take your photos for you. It just might be easier. The third tip is really give context in your photos. As I mentioned, sometimes I look at photos on the phone and I'm not even sure what I'm looking at. Is this a part of their thigh or forearm? I don't know. So in order to give context, take 2 types of photos. One, which is a longer shot. So for example, if there's a rash on the forearm, take a photo of not just the forearm, but also make sure you include the elbow and the hand. So, the person looking at the photo can clearly tell, this is a forearm. The second photo you want to take is a close-up because those fine shapes and changes might give a clue as to what that rash is as well. So take both types of photos. The other tip here in taking photos is giving some sort of context to size. So oftentimes when dermatologists take photos, they actually put a little ruler or something or some object that we all know the size of. For example, a quarter or a dime or some coin. Just placing that coin right next to the rash will give the person looking at the photo an idea of how big that rash is. And then lastly, in terms of photos, try to send the photos to your doctor if you already have an appointment scheduled. This can actually help the doctor triage how concerning the rash is, and sometimes they're able to move up your appointments if they're worried about your rash. The second tool here is to map out your rash. This isn't needed for all rashes, but it can certainly help with some. Print out a body diagram and mark out which was the first area that the rash affected and how it spread. This is important because certain diseases spread from inside to outward, like from the chest to the arms and legs. Other diseases start from the outside and go inward, like from the wrists to inward. And other diseases solely affect, the palms or feet. And those are all very important diagnostic clues that would be important to preserve and let your doctor know when you see them. The third tool here is to think about outlining the rash. This is especially pertinent to if the rash is just in one area or 2 areas, and especially if there's some concern for infection. like if there was a nick in your skin that preceded you having a rash that was red or warm in that area. So do this. Take a surgical skin marker or just a pen and just outline the borders of the rash very carefully. Then look at how the rash has changed the next day. Take photos before and after. This is actually what we do often in the hospital when we're concerned about serious skin infections. This technique helps us track how fast the rash or potentially infection is spreading. The opposite could also be true. The next day, the rash could shrink, and that would be potentially a good sign. So outlining the rash could give us a concrete idea of how this rash is spreading, expanding, or shrinking. The fourth tool here is to journal your other symptoms. Don't forget about the internal symptoms as well. So is this rash itchy? Is there any discharge from this rash? Are you having fevers? Is there anything else going on internally besides a rash? Also, think about the context. Have you changed any soaps recently or any detergents? Things like that can also make a difference in helping your doctor get to the bottom of a diagnosis. Sometimes a rash isn't the full story. It's a signal of what could be going on inside of the body. So, do not neglect those symptoms inside as well. So when should you not wait for that appointment? When should you be seen earlier for your rash? If you have any of these signs, then I would say you need to be seen earlier. The rash is extremely painful, more than what it looks like. The rash is associated with a fever. If the rash is just very extensive and covering a large part of your body, if the rash is starting to slough off and your skin is peeling, that is a very important sign, a danger sign. If the rash is progressing very rapidly, all of these signs could indicate that there's some dangerous reaction or infection, and we need to listen to that very seriously. And that should not be the time when you wait for your appointment. So let's recap. The key to solving your rash is to preserve the visual evidence. Make sure you get clear photos without shadows, and essentially photos that show the context of where the rash is, as well as a zoomed in photo of the details of the rash. Make sure that you are tracking how it's spreading, either just mentally or through a body map. And also in certain situations, making sure that you're outlining the rash if it's one single rash that is painful or red, which could potentially be an infection. The fourth step would be to log any internal symptoms or other symptoms. All of this makes your doctor's job easier, and this improves your chances of a real diagnosis. And if something feels off or is severe, don't wait for that appointment. Go seek help sooner. Your skin is trying to tell you something. Make sure your doctor gets the message.